Holy Cross Hospital brings you House Calls, a community education program presented by the physicians on staff at Holy Cross Hospital. This program furthers the commitment of the Sisters of Mercy to provide quality medical education while fulfilling their healthcare ministry.
Hello and welcome to House Calls. I'm Maria Soldani. Today's guest is Dr. Leslie Sultan, and he's here to talk to us about sleep disorders and especially snoring. Doctor, what qualifies you to tell us all about snoring? What do you really do?
Well, my official title is I am an oral and maxillofacial surgeon.
I see, and I guess that has a lot to do with why it is that we snore, correct?
Among other things, my specialty involves the diagnosis and treatment of disorders and defects of the face, mouth, and jaws. And snoring and sleep apnea happen to fall within that category.
Very interesting. So are you going to start out by telling us, why do we snore?
Whatever you'd like, Maria.
All right.
Why do we snore? Well, there are a number of reasons why we snore, but the main reason is because somewhere in the breathing passages, anywhere from the tip of the nose all the way down to the vocal cords, there's some tissue that's loose. And as we breathe, when we sleep, that tissue tends to vibrate and collapse. And because of that, that vibrating noise causes the snoring sounds we hear.
Is that all?
Well, there are a number of other reasons why we snore. People that have allergies, that have chronic nasal obstruction can snore. People that are overweight, that have excessive bulky tissues in the neck and the nasal passage areas can snore as well. People that take certain medications or drink alcoholic beverages can snore as well, or certain growths, cysts, or tumors anywhere along the airway can cause snoring. And another reason why most people don't realize is problems with the way our jaws grow. Either large jaws or small jaws can have an effect on how we breathe and how we snore.
I'm learning already. I hope you are too. I would like to be able to begin asking a little bit more about the diagnosis. How do you find out what particular reason makes you snore?
Sure.
For example, is it the food, is it the drink, or is it because you have some blocked passages? What kind of test do you do?
Okay. Interestingly enough, Maria, most of the patients that come to my practice are referred to the office by their bed partner. Not necessarily their wife or their husband or girlfriend, boyfriend, but by the person they sleep with.
Right.
And the main complaint that we hear is, I can't sleep in the same room with that person. That person is confined to the other bedroom or to the couch. That person, I'm afraid that he's going to stop breathing while he sleeps. That's usually the main indicator of why we evaluate the patient who snores or has sleep apnea. We go through a very thorough health history with the patient, asking questions about how they snore. Do they dream? Do they dream in color? Do they wake up in the middle of the night to go to the bathroom many times? Do they wake up in the morning refreshed? Are they tired in the morning? Do they have a sore throat? Do they have indigestion? Do they fall asleep easily during the day? Do they fall asleep while they drive? Are they moody? Do they have mood changes? How's their memory? Things like that.
This is very interesting, but I just caught on to the fact, do they dream in color? What does that have to do with it?
The way we dream has some interpretation in terms of sleep efficiency and deep stages of sleep, or the REM sleep. Patients that dream in color tend to have more deep, effective sleep.
Very important to know. See, we're learning things already from Dr. Sultan that we didn't know. Now, if I'm snoring, therefore I might not be getting all the sleep that I think that I'm getting. And that's where sleep apnea comes in?
Well, there's a differentiation between snoring and sleep apnea.
All right.
Just to go through some of the statistics that we see throughout the country, about 45% of the adult population will snore occasionally. About 25% of the population are habitual snorers. Now, not everybody that snores has sleep apnea, but everybody who has sleep apnea does snore.
So the question would be, what is the difference between people that snore and people who have sleep apnea?
Maria, that can tend to be a very complicated question, but what I'm going to try to do is make the answer as simplified as possible.
Good.
Okay. Snoring is usually due to some type of blockage in the airway that's a partial blockage, meaning that there is air that's getting through to the lungs and eventually to the brain while we sleep. Sleep apnea is where there is a complete blockage of the airway that causes the person to have a complete cutoff of oxygen to the lungs and eventually to the brain while they sleep. Now, there are 3 types of sleep apnea. The most common form of sleep apnea is known as obstructive sleep apnea syndrome. That's due to an anatomic blockage of the airway, and that airway, again, goes anywhere from the tip of the nose down to the vocal cords. There's another type of sleep apnea called central sleep apnea. That's more of a neurologic type of a problem where the brain is telling the body, don't breathe. And that's usually due to a number of different types of neurologic disorders. And then there's a combination of the obstructive type and the neurologic type called mixed sleep apnea.
And of course, these different types will be diagnosed differently?
The standard that we use to diagnose whether somebody truly has sleep apnea and differentiating that from somebody who snores is called a sleep study or a polysomnogram.
I see. And don't forget, we have that available here at Holy Cross, correct?
Yes, we do.
And once this person spends the night with us in this very comfortable bed and is monitored to be able to determine what type of sleep apnea they have, then you would then be able to treat it appropriately. And people who are obese, are they more likely to have the type of apnea that is obstructing their breathing?
Well, let's. Your question is multiple
Yes,
multiple
it is. Yes, it
segments.
is.
So let's take one thing at
Okay.
a time. The sleep study is an amazing exam. Basically, the patient will go in to the sleep lab, and they go into a very comfortable bedroom, and they'll spend anywhere from 1 to 2 nights in the sleep lab. While that person is sleeping, they're hooked up to a number of monitors that monitor just about every vital sign there is with the patient, their cardiac, their respiratory, their neurologic signs. And from all of that information, a technician as well as a pulmonary specialist will be able to sit down and determine how many times does the patient stop breathing, whether it's a complete blockage or a partial blockage. What is their sleep efficiency? How well are they sleeping? How much time are they sleeping? What the sound quality is of the noises that they make while they're asleep, what's their brainwave activity while they're asleep. And from all of these things, a diagnosis of whether somebody has truly sleep apnea or not is made. In addition to that, a differentiation can be made whether somebody has the obstructive type, the central type, or the mixed type. Now, you asked another question. Is it more common for people that are overweight to have sleep apnea? Well, again, let's go over some statistics that I think are very important for those people who can potentially have sleep apnea that may not even know it.
Right.
Approximately 50% of the patients in this country that have high blood pressure and heart disease have some form of sleep apnea, whether it's been diagnosed or not. For all the patients in our country that have been diagnosed with a stroke, about 70% of those male patients and about 65% of those female patients have some form of sleep apnea. And actually, about 30% of the cardiovascular deaths in this country are due to undiagnosed sleep apnea. So
That's pretty outstanding. Those are big numbers.
It's very alarming that the disease itself has been unrecognized for the longest time in the healthcare community. Now, is it true that patients that are overweight tend to be more prone to sleep apnea? Yes, because they have more tissue to move around. They have excessive bulky tissues in the head and neck area. But we do see many patients that are under our normal weight category that can also be candidates for sleep apnea based on their skeletal structure.
Right. Well, I was just wondering, what impact, or what other impact, we're talking about the worst case scenario, what other impact can sleep apnea have on a person?
Well, I think an important impact that sleep apnea has, or habitual snoring, is on relationships. As I mentioned before, the most common scenario that I have for my patients that come to the office is a referral from the person that they sleep with. And there are many relationships that have been broken or have been severely affected because of the impact of either habitual snoring or sleep apnea. On another note, patients that have obstructive sleep apnea syndrome are 7 times more likely to have a motor vehicle injury than the normal driver because they have more of a tendency to fall asleep. These patients tend to have mood swings, they tend to have poor memory, and that can affect their work status as well.
Are there some things that perhaps an individual can do to help themselves?
Sure, there are some basic things that everybody can do in order to reduce the chances of their snoring or sleep apnea. For example, weight reduction, regular exercise are always important in a patient's lifestyle. Eating the proper foods are important. Along the lines of nutrition, avoiding any heavy meals within 5 hours of going to sleep. Again, along those lines, trying to avoid any alcoholic beverages within a few hours of going to sleep. Avoiding cigarette smoking is important as well. Avoiding tranquilizers, antihistamines, any type of sleeping pills, because all of those things tend to relax the muscles in the airway and cause that tissue collapse that can tend to cause the vibrating sound resulting in the snoring. If you keep your head elevated while you sleep, that's very good. If you can get a foam wedge to put under your back, it's not uncommon for a doctor to tell a patient to avoid sleeping on their back by sewing a tennis ball into the t-shirt or pajamas when they go to sleep.
I see that the things that you listed included not having alcoholic beverages before or within 2 hours of going to sleep. But you left out one of the things that I think is a culprit in a lot of the folks that I know that snore, and that's that snack, whether it's ice cream or drinking milk. Do some of the products that are milk-based sometimes cause people to snore?
I can't really answer that definitively, but I can tell you that some of the home remedies that you see over the internet are based on solutions that will lubricate the back of the throat that tend to decrease snoring. So I'm not sure if I can answer that question exactly for you.
All right. Well, then we're getting to know more and more every time we talk to Dr. Sultan and we ask him more questions. Let's take a break now, and we'll be back, and we'll find out how it is that we're going to treat these problems.
Are you in the shape that you want to be in? Isn't it time that you worried about your health? Well, take control of your life now and join the Zachariah Family Wellness Center at Holy Cross Hospital. At the center, we will help you set realistic goals and, more importantly, help you achieve them. Our medically trained fitness instructors are available to give you hands-on guidance. From cardiovascular equipment to sophisticated FitLinks monitoring systems, everything you need to get physically fit is at your disposal. In addition, the center offers a variety of classes including yoga, spinning, tai chi, and kickboxing. Instructional classes on nutrition and health are available. How about a massage or some aromatherapy? Have a snack or nutritious drink in our Heart Healthy Cafe. If you're looking for the total package, look no further than the Zachariah Family Wellness Pavilion at Holy Cross Hospital. Call now for your initial assessment. Get the look that others will be looking at.
Well, we're back, and we have Dr. Sultan with us, and now we're going to talk about the different ways of treating sleep apnea and snoring. Are there different ways of treatment?
Well, let's just back up a little bit. Evidently, from this talk, snoring and sleep apnea are definitely related. And many of the treatments that we use for snoring are involved with sleep apnea. Obviously, as somebody progresses from snoring to sleep apnea, the treatments can become more involved, but they are related as well. There are things that the patients can do on their own, which we've already discussed. There are medical treatments that can be performed, and then there are surgical treatments that can be performed, depending upon the type of the problem, the extent of the problem, how well the patient responds to different forms of therapy, and their desires to go on for different treatments.
Well, that answers it. So how would I treat snoring if I wanted to try something that was non-surgical?
Well, many patients first turn to the internet.
Okay.
They plug in keyword cures for snoring, and there are probably about 100 different websites
Really?
that you can go to for non-surgical remedies for snoring. Most of them, unfortunately, and I guess I'm biased, are quick fixes. They may help for a short period of time, but they're not permanent cures. Just to go over a few of them, there is one type of cure that is a clip that goes on the nose that's supposed to open the nasal passages.
Right.
Now, there are two ways that we can breathe. We can breathe through the nose, we can breathe through the mouth. The majority of our breathing goes through the mouth. So if we try to treat something in the nose,
Really?
it's really not going to be 100% effective. And for sleep apnea, nasal blockage is only a minor component of the blockage itself. Now, another form of treatment are these lubricating sprays that people can use that tend to allow the tissues to stiffen. It's only a temporary quick fix. Okay? And then another way of treating it is just bypassing the whole problem by putting in earplugs.
What if I wanted to do something about it permanently? What would you do?
Okay, well, let's take the next step. Let's take somebody who is a habitual snorer, but still wants to evaluate whether there are non-surgical options.
Right.
Well, there is a device that is made by certain dentists in the community that's known as a jaw repositioner appliance. Anatomically, our tongue, which is the most common form of blockage in the airway, is attached to an area behind our chin bone. As we tilt our heads backward, our jaw falls against the back of our throat, and the tongue falls against the back of the throat as well, blocking off the airway. So, if we're able to bring the jawbone forward while we sleep, we also pull the tongue forward. And that opens the airway, reducing the chances of snoring. And that's also a treatment for some forms of obstructive sleep apnea. These appliances are custom made. Not every dentist will make it. There are probably about 50 different types of appliances that are on the market, and it's really user preference according to the dentist that does the technique, and it is very effective. Unfortunately, the percentage of patients that will use these appliances long term is about 40%.
Really?
Meaning that 4 out of every 10 patients will still have that appliance in after 8 hours of sleep.
Oh, I see. So they're not compliant. They actually take it out and put it by the bedside.
Well, they
and go
actually
back.
spit it out.
Ooh.
Or they pull it out. It's a very confining appliance. It tends to hold the jaw forward in a certain position. It doesn't give a lot of freedom of movement, but it is very effective in many situations. Now, let's say the severity of the problem gets a little bit worse and the patient has some type of obstructive sleep apnea. The pulmonary specialist or the sleep medicine specialist may recommend using continuous positive airway pressure, or CPAP, CPAP. CPAP is breathing oxygen under pressure. There is usually a mask that goes over the nose itself or over the nose and the mouth at the same time, and it's hooked up to a small machine. And as the patient sleeps, he's breathing oxygen under pressure, and that oxygen under pressure actually blows open the airway, allowing the oxygen to get to the lungs and allowing the patient to function well while they're sleeping. And that has really been the classic form of non-surgical treatment for the patients that have sleep apnea, whether it be mild, moderate, or severe. Unfortunately, Maria, the same type of compliance problem that we see with these jaw repositioning appliances is the same for somebody that uses CPAP. The long-term compliance rate for somebody that uses nasal CPAP is somewhere around 40%.
And that is because the equipment is so...
It's very bulky, it's cumbersome. Some patients complain that, it just affects their quality of life.
And these are all things that do not require surgery. But what would be the indications for somebody to require surgery to resolve some of these problems?
In terms of what's available along the surgical options, again, we have different stages. And there are protocols that we use. For example, if you or somebody that you cared about came in and they were diagnosed with sleep apnea, again, we would categorize their problem based on, number one, the severity of their problem. Number two, if it was obstructive sleep apnea, where the areas of blockage were in the airway, and then what their desires are for treatment, because we want to tailor the treatment for each individual patient. And as a general rule for surgery, we don't want to make the treatment worse than the problem itself.
I see.
So we always try to start off with the more simple forms of treatment that can get a good result. But we always give patients options as to different things that we can do.
Mm-hmm.
In terms of the options, let's look at patients that have mild forms of sleep apnea. Usually those patients have one, maybe two areas of blockage. What we can do is offer these patients treatment that will either shrink the tissues or can reposition the tissues to try to open up the airway. And there are a few ways of shrinking the tissues. I'm going to use some trade names because those are synonymous with the type of treatment that there is. One of the main treatments that's used today is known as radiofrequency volumetric reduction. Basically, what that means is heating up the internal structures of either the palate, the base of the tongue, the tonsils, or even the nasal passages, causing scar tissue to form internally and allowing that tissue to shrink and firm up. There are two products on the market that we use. One is known as somnoplasty. The other is known as coblation. Both procedures are done in office. It's done under a local anesthetic or a Novocaine type injection that you would get from a dentist. The treatment can take anywhere between 5 minutes and 20 minutes.
Really?
Minimal discomfort, no more than a mild sore throat or a cold.
Wow.
Usually my patients routinely require nothing more than Advil or an anti-inflammatory for pain. There's no bleeding, there are no sutures, there's minimal swelling. There's also a technique available where an injection can be placed within the palate to cause a stiffening of the tissue. That's something that's still in the early stages of being tested on the market. And those are the basic treatments that we can use to shrink the tissues. Now, as the problem gets more advanced and the blockage gets more severe, we may not be able to shrink the tissues enough in order to get a good result. So at that point, we're able to offer techniques where we can actually reposition the tissues. And the repositioning of the tissues concentrates mostly either on the palate, the base of the tongue, or the jaw structures. The majority of the blockage in patients with mild, moderate, and moderately severe sleep apnea is based in the oral airway area, the soft palate, the tonsillar area, the base of the tongue, and the jaw structure. There are a number of procedures we can use on the palate in order to try to reposition the tissues, or in more severe cases, even remove some of those tissues in order to open up the airway. Most times, a palatal procedure is combined with something to do similar treatment on the base of the tongue. If you remember earlier, the tongue muscles are attached to the jawbone right behind the chin. So we can do certain procedures to actually tighten the internal muscles of the tongue and pull them forward, so as the jaw goes back when we go to sleep, the muscles are suspended off the back of the throat. That can be done with a technique where we pass a suture or a stitch all the way through the muscles of the tongue and pull things forward. We can actually make a small window in the chin from the inside of the mouth, pull the muscles forward and secure them to the front part of the jaw. We can do different modifications to the jawbones themselves and bring the jaw forward, which will do the same thing. And that not only may give the patient a good functional result, but also give some cosmetic improvement to their profile. In the more severe cases of sleep apnea, again, we may need to remove tissues of the palate, tongue, not of the tongue, but the palate, tonsillar base region. We sometimes have to move some of the bones in the neck forward in order to tighten tissues up. And sometimes we can even move the entire facial complex forward as a unit to open up the airway. In the most severe cases of sleep apnea, the treatment that's 100% effective in these cases is called a tracheostomy, which is an opening into the airway from the neck itself. But those are only done in rare situations.
Right. That's an amazing amount of information you just shared with us. But as you were describing some of these procedures, I was thinking, does insurance cover them?
Well, that's a very good question, Maria, because many patients that come to my office ask and many times expect their insurance carriers to provide coverage for what they need. There's a major distinction between treatment here, and that is the distinction between snoring and sleep apnea. Snoring is considered a condition. Sleep apnea is considered a disease. Because of that, most insurance carriers will not cover treatment for conditions, only for diseases. So if somebody is diagnosed with habitual snoring, most likely their treatment will not be covered by their insurance. If they're diagnosed with sleep apnea and they're considering surgical options, they normally have to go through a sleep study. They normally have to go through a course of non-surgical therapy and have all of that documented before the insurance company will consider them for the surgery.
Well, that's excellent. That's good to know, because now we know that we have options. And I'd like to just finish the program by saying that it's just been a pleasure to have Dr. Sultan here. And if you would like to know why it is that he was chosen to speak here and learn a little bit more about him, call our physician referral line at 954-776-3223 or visit our website at www.holy-cross.com. And if you would like to invite Dr. Sultan to come to your club or your church or your condo and do a presentation like he did today, call our public relations office at 954-776-3080. We'll be glad to make all the arrangements for you. And on behalf of the Holy Cross family, I'd like to thank Dr. Sultan again and to tell you that we'll see you next week, and be well.